Here is a girl that you're scanning for abdominal pain.
So,
yeah, ovarian cyst.
but she has also
and
something that looks like
some free fluid.
It looks like it's hard to say because I would say it looks like an appy on the left side, maybe like the tubal. But again, it's a weird view that we don't used to see so much. Like the right side looks like some ovary maybe to me, but the left thing, I don't know exactly what it is, but for me it looks like it could be like transverse cut of an appy even. So I don't know exactly the scenario you see.
Yeah, I'm not sure where they are. I mean, and it says long.
I don't know.
Like, could it be the? I don't know. Could it be the uterus, but it's actually transverse?
But then if it's not, it's still vagina. Like that's what an gestation sac might look like, but that's not a uterus. Where's the bladder?
Yeah, I don't know. That's really like.
So there's no bladder. That's not uterus.
Or
so what is it?
Bladder. Sorry, ovarian cyst and fluid in ovarian cyst and fluid in endometrium. That's what they say.
Oh, so that's what it is. So it's fluid in endometrium.
Yeah.
Even though you don't see vagina, you don't see bladder.
That's
I don't know. Unless I was doing this scan, I wouldn't know what that was.
okay.
So I think long is wrong and it's actually transverse.
Yeah.
No, I think they're long. They're just like rocking like that, probably. That's what I think they're doing. I don't know. But that, what is like this hypercoic?
That's what the endometrium lining.
That's the endometrium thing?
Yeah.
That's what they're saying. Fluid
Exactly.
in the endometrium.
Yeah.
So that's fluid in the endometrium. So that would be the lining.
Yeah.
Which is
That's
weird, right?
like here.
So that's why I think we're transverse.
Yeah.
But I agree with you. Like, where is the bladder? I'm not sure.
Like I have a hard time with this one.
Okay. Whatever.
Well, I'll say
whatever they want to say. Yeah.
And here.
It's teratoma or something. I don't know. Ugly mass.
Yeah.
Some kind of a cancer.
So you're also right, like you're also in the like pelvic area.
It's huge.
And that is a complex ovarian mass. Like, yeah, it's huge. Probably, I don't know, teratoma possibly.
You can see the teeth. Yeah, smile.
I think I presented a teratoma last time. Where are the teeth?
Here's another example of an ovarian cyst. They can be really tricky.
You don't always see them. You only see them when they're really big.
Yeah.
It's really hard.
That can be a torch.
And here, what is that? You're in the pelvis. You have the bladder. And what is that huge tubular structure underneath the bladder? It's a boy.
It's a mega.
It's a boy.
Just to make it simpler. Maybe it's a girl, but
It's a prostate.
no.
It's a mega ureter that bulks in the.
It's a hydroureter.
Yeah.
Really?
Yeah.
It's huge.
It's huge, right?
I've never seen them.
Yeah, it's a ureter that bulges into the bladder.
Exactly. Huge one. And then you go up to look at the kidney.
Here's the bear claw.
And you have a huge hydronephrosis. Exactly. Here is, what is it?
Again.
In the abdomen.
the abdomen.
We're in the right lower quadrant.
Yeah. So again,
And there was like some, so
again, some kind of
patient is coming with abdo pain.
some kind of, again, lymphatic malformation, some kind of.
Yeah, exactly, lymphatic malformation. And that patient actually came in for abdo pain, was diagnosed with a lymphatic malformation, went home, came back a couple of weeks after with acute pain and bilious vomiting, and had actually a volvulus of her lymphatic malformation and all the bowel linked to it. Had to have surgery. They removed the lymphatic malformation and the part of the bowel that was linked to it, but there was no ischemia of the bowel. So yeah, interesting. So exactly, it looks exactly the same as the neck lymphatic malformation that we had seen at the beginning of the presentation. But it's, yeah, so you can have lymphatic malformation from anywhere, really anywhere. And that one was in the bowel and in the mesentery, actually.
Do you do any radiology? You send these patients to radiology to get another ultrasound, or what do you do?
Yeah, you would get a formal ultrasound for sure. And then usually they would do an MRI, and then they would do sclerotherapy. So that was the plan. You can do, like, you can inject there is a couple of different substances that you can inject that you actually remove the fluid, and then you inject those chemicals that are just gonna collapse and scar everything together. You usually have to repeat the process several times, but that works pretty well. And then if that doesn't work, you can do surgery.
Most of these patients are not managing QT.
Yeah, no, it's definitely. So you do just a ruffle for jet surge. And if it's more like the neck, or then it would be plastics. And then, yeah, it's IGT who would do the procedure usually. Surgery is not as easy because there is a lot of surrounding structures that you don't want to injure. So that's why they usually start with sclerotherapy, and then they would do the surgery as needed. And here is another lymphatic malformation close to the bladder, yeah.
As opposed to ovarian cysts. It looks kind of similar, but it's not, obviously, because it's midline.
And then you put flow on it, and that's how it looks like. So you have the flow around, but nothing in the structure. So it's not an AVM, but it's a lymphatic malformation. Here another one. And here. So you are doing a fast, left upper quadrant. It's not moving, sorry. So exactly, cysts in the spleen.
I don't know, I just came from Uganda, so everyone that had cysts in the lymph
Definitely.
was like,
No, right.
or
No, it could be. Yeah, no, it could be, but we're actually in the same spectrum as all the previous images.
Yeah.
So it's lymphatic malformation, but you're right. Should definitely think about parasites. Or TB, yeah. Here is a just simple lymphatic malformation. I mean, simple. So it's more like microcystic lymphatic malformation of the spleen. And here, you're in the abdomen. It's a patient who has abdominal pain, has had like abdominal pain for the past 3 weeks, has had a couple of ultrasounds done.
This is this I remember.
That now you remember.
No, this image I remember. This is the kid with the mirror.
Yeah, exactly. It's a Meckel.
And how can you differentiate that from?
We can't. I mean, like we just. First of all, this story of this kid, actually, it's interesting because he came like with like acute abdomen, so he went to do a comprehensive ultrasound, and so we went to scan him, so he was already after. So So we just want to scan them, and then of course we put the probe, and of course we were with Mark. I said, what's that? Stop on that. I think Michelle did it first time. I think this is the second time.
Yeah.
I think that's me,
second
because
time.
here it looks more like inflamed around. And then you would just focus on that, and it looks like thickened wall, a cyst, encapsulated.
No bowel motion. Like
No.
It's not that. There is no peristaltism.
Peristaltic. And so the differential I noticed is some kind of a cystic structure. So it was mesenteric or Meckel, so that was one of our DDs. So then we send him back. Comprehensive abdomen. We think we see something that you haven't been
Able to see.
able
So
to
please
see.
redo your ultrasound.
Oh, no, they need that.
Yeah.
Yeah.
No, they didn't. On the first report, they
missed
wrote
it.
like everything is fine, like we don't see anything. And then the second, they say yeah. And then I think he did a technetium scan that proved that. And then he waited for a definitive surgery. But in between, he felt some kind of a pain. So he came back. I think it's the second time he came, and it was a lot more inflammation and thickness around it. So he just took him to surgery. He didn't want to wait for it.
So yeah, beautiful
And
mechanism.
after we're gonna write it, it's gonna be published right now.
Yeah,
So
it's true,
gonna be
like,
cool images.
Yeah, we should definitely write it down. And here.
That looks like a baby.
Yeah, so other cystic formations that you can get in the abdomen.
Yeah.
You can see the heart.
Mazel tov.
You can see the little heart
I'm
beating.
sure this patient was very happy.
Probably it's a nurse.
Yeah.
Okay.
Sometimes it can be a nurse that wants us to scan her, but maybe it's
Yeah, it's
but
usually
no, maybe
like
it's
that.
a patient. I don't know.
It's usually just like
No, usually if
nurse
it's a
or
nurse, it's a
colleague.
good story. So probably it's a real patient.
Yeah. I've seen a few. 14, 15, 16.
Yeah, no, definitely. Yeah, Mark has had a couple of teenagers coming in the emergency with and
In New York, not
the
in
worst
here.
is always that.
Scarborough happens all the time.
Yeah, and the
Well,
problem is that you
Scarborough
have
is
the
like New
parents
York,
in the
no?
room, you have the mother in the room, and the mother would recognize what is on the screen, and you're just like, oh shoot, yeah. Anyway, that's it, guys. So sign-in and evaluations on the links, and thank you.
Oh, nice clapping.
Yay!
Magali, that was
That's it.
very
Weird
interesting.
and wonderful.